name's Ashling. I'm going to be doing your assessment today. Is that all right?
Yes.
Okay, great. So I'm just going to wash my hands over here. All right. Can you tell me your name and date of birth?
Hannah Witten, January 3rd, 2002,
Okay. And can you tell me where you are right now?
in a doctor's office.
Okay. And what's the date today?
August 9th, 2020,
Okay. And who's the president?
Donald Trump.
All right. So I'm going to start off by doing a range of assessments. First thing we're going to have you do is count from 100 backwards in sevens. Okay. I'm going to do that for a minute.
100, 93, 86, 79, 72, 65, 58, 51, 44.
Okay, we'll say we did that for a minute. The next thing I'm going to have you do is take this piece of paper. You're going to fold it and place it on the floor for me. Great, thank you, Hannah. Okay, so can you tell me how you spent your birthday last year?
I went to the movies with my friends.
Great, okay. Alrighty. The next assessment I'm going to have you do is I'm going to tell you 4 words. You're going to remember those words, and then I'm going to ask you to count from 100 backwards in groups of 20, okay?
Okay.
And the word is bird, ball, blue, and beach.
Okay.
Okay, go ahead.
100, 80, 60, 40, 20.
Okay.
Bird, ball, blue, beach.
Great. Okay, so now we're going to assess your skin, your hair, and your nails. If Hannah was wearing a gown, I'd be able to see her full body. I'd be looking at her skin for the color, tone, if there's any lesions or masses, any abnormalities. I'm going to be checking her fingernails for circulation response time. So I'm pushing down on the finger braid, making sure it's less than 3 seconds, which is an appropriate response. I'm looking at her skin, making sure it's intact, there's no abnormalities. I'm checking circulation in her lower legs and her nails on her feet. Circulation is less than 3 seconds response time, so that is appropriate. Then we're going to go back up to her scalp. We're going to check her hair, making sure the distribution is accurate, it's appropriate. Checking for any lesions, lumps, any abnormalities, any pain anywhere or swelling.
No.
Nothing like that. Okay. Then we're going to move on to her trachea. It is midline. I'm going to go to her temporal. I'm going to palpate bilateral pulses here. They are 2+ and bounding. I'm going to auscultate the temporal arteries. Okay, +2 and bounding. Next thing I'm going to do is palpate her sinuses. Tell me if there's any pain when I push into your sinuses. Any pain?
No.
Okay, and what about here?
No.
Okay, now I'm going to check her jaw for TMJ. See if there's any clicking. Open and shut your mouth for me. Any pain or tenderness?
No.
Okay, and there's no swelling. No clicking. Okay, now I'm going to check her lymph nodes. Looking for any abnormal swellings, any pain or tenderness. Anything at all?
No.
Down here? Any pain?
No.
Okay. I'm going to check her carotid pulse, one at a time. It's +2 and bounding. +2 bounding bilaterally. And now I'm going to auscultate your carotid. That's good. Okay. We're looking for any bruit. I didn't hear anything. The sounds are all normal, so that's good. +2 bounding. Right, Hannah. So now we're going to assess your eyes, ears, nose, and throat. First thing I'm going to be doing when I'm looking at your eyes is making sure they're symmetrical. I'm checking to see if the upper or lower eyelids are swollen, tender, any pain or redness, nothing like that. Okay. Now we're going to check your pupillary response. Okay, so we're going to dim the lights and you're going to look at a point straight across the room. Okay, and I'm going to check your reaction to the light.
Okay.
That's good. So pupils are equal, active, round, and reactive to light. Okay, so now what I'm going to do is check the accommodation of your eyes. So I'm going to turn the lights back on. You're going to look at a point straight ahead, okay? And I don't want you to move your head at all. You're just going to follow my finger, okay? And I'm going to test your eyes' reaction to my finger coming closer to you, okay? Okay, so your eyes are accommodating. Okay, we're going to check now for nystagma, which is an irregular movement of your eyes, okay? So what I want you to do is follow my finger and don't move your head, okay? Good, okay. Now I'm going to check your peripheral vision, so just tell me when you see my finger. Look straight ahead.
Right now.
Okay, and then from this side.
Right now.
Good, okay. Now I'm going to inspect your ears. I'm going to look at the exterior of the lobe, just checking for any redness, swelling, any abnormalities. Do you have any pain at all? Okay, let me check this ear. Okay, now I'm going to whisper 2 words. You look straight ahead and just tell me what you hear.
Okay. Yellow duck.
Okay.
Blue cloud.
Good. Okay. So now I'm going to check your nose. I'm going to see the patency of it. So I need you to hold one side and blow out for me. Good. And do the other side and blow out for me. Okay, and I'm just checking your face, making sure the nose is symmetrical. There's no redness, pain, or swelling. And looking inside, I don't see any discharge at all. There's no redness or swelling. Okay. Now, I want you to close your eyes. I'm going to give you something to smell. And you tell me what you smell, okay?
It's an ocean breeze candle.
Very good. Okay. All right. Next thing I'm going to do is examine your mouth and throat. So just open your mouth for me. And stick out your tongue, side to side, up and down. Okay, I'm just checking inside. To check the gag reflex, I would get an orange stick, put it towards the back of the mouth, and check her gag reflex. I don't see any chapped lips or any lesions or anything to worry about in the mouth. The mucosa is moist. Her lips are pink and moist. So now I'm going to do a cardiac assessment of you. First I'm going to do is look at your neck. I'm looking for any jugular vein distension, so if you just turn that way for me. Good, okay, now turn the other way. Alright, so now I'm going to palpate your carotid artery first. We're going to do this side first. Okay, and now the other side. Okay, it is +2 in bounding, that's good. I'm going to move down to the brachial bilaterally. good. +2 in bounding. I'm going to do your radial pulses. Okay, and now down to your femoral. It's good. +2 in bounding. Now your popliteal. Okay. Posterior tibialis. That's good. +2 in bounding. Your dorsalis pedis. Okay, +2 in bounding in all pulses. Okay, now I'm going to listen to your heart sounds. Just going to go into your breast. Okay. Okay. I'm going to listen to your renal artery. Your iliac. Okay, and then your femoral arteries. That's good. And then your aortic. So now I'm going to check your circulation in your hands and feet. So I'm checking the capillary refill time. I'm pushing down on the nail bed. It should be 3 seconds or less. That's good. I'm going to do the same thing with the toes. Pushing down on the nail bed. And this one, it's 3 seconds or less. So circulation is adequate. And if I had a pulse oximetry, I would put that on her finger and it would tell me her oxygenation saturation level in her extremities. Okay, so now I'm going to inspect your chest. I'm going to look for equal chest rise and fall. Take a deep breath in for me. That's good. I'm going to check the spine. Good. Deep breath in for me. Good. So it's equal chest rise and fall. I want you to repeat 99.
99. 99.
Okay, and on the back, same thing.
99. 99.
Okay, so now I'm going to percuss on the back. I'm going to do it 10 times. Okay, so now I'm going to percuss on the anterior lungs 6 times. Okay, so now I'm going to auscultate the lungs, doing 6 times at the front and 10 at the back. Take a deep breath in. That's good. Right, deep breath in. Okay, and lung sounds are clear. And I'm just going to need you to come lie down on the couch here. So I'm going to lift up your shirt and I'm going to inspect your abdomen. Okay. And auscultate from the right lower quadrant, looking for bowel sounds. That's good, they're nice and active. That's good. I'm going to percuss your abdomen. I'm going to do light palpitation. Any pain or tenderness? Good. I'm going to do deep palpitation. Let me know if there's any pain at all.
Okay.
Okay. I'm going to palpate for the right liver. Okay. Palpate for the spleen. Okay, Hannah, so now I'm going to assess your range of motion. Let me just check your spine first. I'm just going to assess it. Okay, now what I need you to do is your head from left to right. Okay, and now push against my hand, forward, and now backwards, and now to the right, and to the left. Okay, and now put your legs out from side to side. Good, okay, and your shoulders, try to push against my hands, lift them up and down. Good, okay, and your arms, put them out, push against my hands. Okay, good, okay. Now put your arms out and crisscross. Okay, so now I want you to do is pull against my arm and then push. Good, okay. Pull against my arm and push. Okay, now rotate your wrists. Okay, and up and down. And squeeze my hands. Good, okay. And then bend over from side to side. Good. Now I'm going to have you have a seat right here. Alright, so I want you to push against my hands. Alright, I'm going to pull, you push. Alright, rotate your ankles for me, in and out. Okay, and have your feet push up. Alright, and then push down. Okay, good. Okay, Hannah, we're going to check your neurological status. So what I need you to do is give me a big smile, clench your teeth together, move your jaw from side to side, raise your eyebrows, and frown. Close your eyes tight. Okay, smile for me. Open your mouth and say ah.
Ah.
Stick out your tongue. Okay, so for your motor assessment, just run your heel up and down your shin. Okay, now put your finger to your nose. Okay, so now I need you to stand up and walk heel to toe. Okay, and now tiptoe. And then rapidly turn around. Great, and then walk back this way, heel to toe. Great, you did a great job. Thank you very much.